So I'm just loading up the gun. So this is a disposable needle cartridge. It comes in a 5 or 9 needle variety, and because I'm doing the back of the hand here, I'm using a 5 needle variety. This is a Deca SmartSide squared fractionated CO2 laser. It's a resurfacing laser. It's a very versatile piece of equipment that enables me to do a fractionated treatment, which means I'm not taking away the whole surface of Kate's skin. I'm actually removing about 13% of the skin surface, and then I'm causing heating of the surrounding areas there. So what the effect of that will be to burn away some of the abnormal tissue on the surface and then stimulate collagen production because of each of those little burns. So this is the best way we have to rejuvenate the surface of the skin on Kate's hands. Resurfacing has been done on the face for many years, since the 80s, and originally it was done with lasers which took the whole of the surface of the skin away, which gives a very good result, but there's a long downtime and a potential for complications. So in the last 15 to 20 years, we've produced fractionated lasers, and a fractionated laser doesn't burn the whole of the skin surface, but burns a series of little dots or channels into the skin. And the difference is between each little burn or laser area and the next one, there's a little bridge of normal untreated skin. So these bridges heal the dots from the sides rather than the skin having to heal from below. And what that means is we cut our downtime down from a few weeks to a few days, and we reduce the risk of complications. But it does mean that because we're only treating a fraction of the skin surface, or in other words, we're splitting the treatment into fractions, we have to repeat this treatment 2 or 3 times to get the same type of result we would have been able to get with a single treatment before. One thing with that though is full resurfacing was only ever able to be done on the face, because areas like the backs of the hands and the neck and chest would not, the skin won't regenerate from below entirely. So this type of laser can be used on hands and necks and chests, whereas the original resurfacing lasers couldn't. These are used to protect your eyes. Okay, and that's one hand. As it heals, that way it doesn't look like such a kind of glove that's on there. Okay, so we're going to use PRP in this situation now as a wound dressing. So we've got a freshly lasered area of skin, and we've got our platelet-rich plasma, and we're just going to drizzle that onto the skin, and it will soak into all the tiny little laser burns like it's being soaked up by a sponge. The platelets will then lodge in these little burns, and they'll release their growth factors, and that will set up an accelerated healing process in the skin. It also shortens the downtime, and it also soothes the discomfort of the time. So if Kate's hands were stinging and feeling quite hot now, the PRP that I'm putting on there now will act as a soother as well. It will tend to settle it down. We're saying we can use PRP in many ways. We can inject it into the surface of the skin like we were just doing with the neck and in the hands. We can use it as a wound dressing topically afterwards, and we can also inject it deep into the skin, into the fat pads, to create a form of revolumization. With the backs of Kate's hands, we lasered those as well, so the surface skin is actually going to dry up into these tiny little scabs. That process will take about 3 or 4 days, and then the hands will start to peel. So before that, they'll feel a little bit like sandpaper, like they do now, and then that will peel off along with a lot of the pigmentation and freckling, and the hands will then be pink. And that pinkness might take another 3 to 4 weeks to settle down completely after a laser treatment like this. Once again, there's 4 phases of wound healing. So there's hemostasis, which is the first couple of days, then a settling inflammation as the redness dies down. It's only after that point that we get collagen stimulation, and then from there onwards, collagen remodeling. So the whole process of healing after a laser treatment like this goes on for somewhere up to 6 months. With a fractionated laser, because we've really only treated about 13% of the skin surface there, it would be best if Kate could come back and have a second or even a second and third treatment within the next few months. And that's not a difficult thing with hands. So ideally 2 to 3 treatments within a 6-month period, and then we'd be looking at doing a top-up treatment every year or 2.